here we are, ChiroMafia. Look, I was a little bit late. Sorry, I just had to eat some eggplant parmesan with my breakfast this morning.
Interesting.
So, yeah, so I have to apologize. We might be starting this a little bit late. Not that anybody's live anyway, we record it, but hey, it's all good. And then I noticed Joe came on, but he had some sauce stains on his shirt, so we had to go back and change his shirt.
Not true, not true. I was eating salmon, capers, and yogurt just a little while ago. So
Really?
yeah, it was good.
With a side of pasta?
High protein, man. Good for me.
Ah, there you go. I was doing something the other day. I was with my nephew, obviously Italian, and I'm like, shit, man. I always have stains on my shirt after I eat. That's totally Italian. And then I remember growing up. He goes, when we grew up, because he grew up in my mom's house. My sister lived with my mom. He's like, I didn't even know that you're not supposed to tuck a napkin in your shirt when you eat. Like it wasn't until he moved out, he met his stepdad and they got married. Like he just thought that was normal. You just tuck your napkin in the top of your shirt.
That's funny. Exactly.
I know. And after he eats, he's always got stains on his shirt.
It's
Probably because
important.
everything is dripping in sauce and, come on.
And sometimes, it's from the plate. You spin in the fork quick or whatever, and it splatters up. So I don't always tuck it in, but if I got something that's got some liquid in there, I hold the napkin up as I'm eating, and it does help.
Yeah. Yeah, it does. I just tuck the tape after a while. I just leverage, man. Tuck the
Tuck it in.
tablecloth in there because you're going to be talking with food in your mouth, and if something flies out, it doesn't go to the floor; it just lands on the tablecloth. Like, oh, okay,
The
so piece of
tablecloth.
meatball, man, that
Man,
doesn't go to waste.
that's funny.
Anyway, so yeah, man, you got a great message. So we were talking about it before we started recording. So let's get rocking and rolling, man.
Yeah,
You got a
I
great
think,
message.
I remember Dan Sullivan and I, who I love, we talked about this a while ago, and we were doing some videos to promote a program that we did together called Retention and Ultimate Retention, which was a great program. It talked about different skill sets and examples and communications and questions that we would use in the practice to help lead people to retention. And in doing that, we did a couple of videos, and one of them, you never know what's going to hit, right? And we did one, and it was called, do you treat or do you care for people? And it was actually the most popular video that we did. And we were both kind of surprised by it, I think, because we had some other topics that we thought were going to resonate in a different way. But, that really told us, I think, where that needle is. That I think when I talk to doctors, chiropractors that are in practice, and they talk about, at the point where they're kind of at a breaking point, or they're getting burnt out, or there's apathy in there, or you talk to docs that maybe don't even feel that way, but they're rocking and rolling. And I say, hey, listen, what's the part of your practice that you don't like that you dislike the most? And they'll usually talk about symptoms. They talk about, people are complaining all day long. They're talking about their symptoms all the time. They're bringing up their symptoms all the time. They're discussing how they feel all the time. I'm dealing with pain all the time, and you realize that we're treating people, or at least we don't want to, in the sense, but we're treating people rather than caring for them. And the big question I always have is, what's your intention? If I'm adjusting you, if I'm using the adjustment as itself as a treatment for a symptom or symptomatology, then I'm really doing natural allopathy, right? I mean, the mindset, I'm not saying getting adjusted doesn't help people with symptoms, but what I'm saying is if you believe that you're treating people with an adjustment in an effort to resolve symptomatology, that's an entirely different practice. You're going to attract symptomatic people versus the practice where I'm adjusting people to remove obstructions that allow their body to heal so that their body can heal and function better. That's an entirely different practice because everybody needs to be cared for. Not everyone needs to be treated because treatment's threshold is symptomatology or dysfunction. So treatment is I hurt, I need care, I don't hurt, I don't need care, right? So why would I come in and get treated if I feel great? So the average person walking in and says, hey, geez, I don't feel good. And we believe as chiropractors, hey, I'm gonna start adjusting this person. No offense, they're treating them, and they're gonna feel better. And then I'm gonna prove myself to them. Oh my God, Dr. Fred, I can't believe it. I'm feeling so much better. I'll do whatever you say. And it works the opposite way. What happens is you treat them, they feel better, and they're like, hey, listen, thanks. I'm done. I feel great. I know that other stuff that you were talking about, but at this point, I feel really great. I'll call you next time I have a problem. And let me tell you, I'm going to tell everyone about you. Everyone, anyone asks, you're my guy. You know, you're the go-to guy. But that's a treatment practice. If they don't feel better in their own mind, they come up with a deadline, they come up with a threshold, then they leave. If they feel a little worse or a little sore, they leave because you have set it up or you haven't repositioned them to the idea that what I'm doing is I'm caring for something that's already in your body, that's innate, that's healing your body. So we sometimes get stuck in the idea that I'm treating people. Well, listen, I could get joint cavitation on a cadaver and nothing's going to happen, right? But that's because there's no life in there. So what you're really doing is you're caring for them. You're removing obstruction to the innate that itself is doing the healing. We're not doing the healing, right? So if we look at it from that perspective, everybody needs care, irrespective. It has nothing to do with their symptomatology. So therefore, the practice people you attract, the practice people that stay, the members that stay, they stay for a lifetime because everybody needs to be cared for a lifetime. Not everyone needs to be treated for a lifetime. And I think understanding that distinction sometimes seems subtle, but it's monumental, is the difference between going to bed at night going, oh my God, how many new ones I have scheduled this week versus going to bed and going, man, I got a ton of people coming in and I got 90% of them are well people. They're coming in just to keep feeling good. And it's a much better, higher volume, much more happiness, more stable, higher amount of income, more freedom type practice.
Well, and as you're going through this, I have 25 things going through my mind, so I'll try and shave it all the way down. First of all, the language that people, your patients are using with you is the language that you taught them. It doesn't mean that that's your intention. Now, the problem is I use this one liner all the time. Your title is your problem, meaning doctor title's the problem. Why? Because that puts you in the model of healthcare.
Correct.
Now, this may seem totally counterintuitive, but what's healthcare in the minds of people? You have a problem, you go to a doctor, he solves the problem, and then you're done. And that's it. So if you're doing all these machines and you're doing all these things because you're trying to reduce the symptom, that's what you told them and it will work. Now, I'm not saying don't use the machines, but what's the meaning that you're giving? You know, you personally never use machines because one, if you got a symptom, you're subluxated. Two, when you remove the subluxation and you're correcting them, the only reason they have a symptom is you got inflammation. There's not energy getting there, but the minute you restore the energy, healing is instantaneous. So it starts, we didn't focus on the spine, we focused on the spinal cord, and you're an energetic being. And the only reason you have a symptom, every patient only has one problem. You never took care of your spine and nervous system. Right. So why do you have 5 subluxations, 6 postural distortions, and 18 different health problems? Because you're 46 years old. None of your MDs or other healthcare providers or other chiropractors even talked to you about this. You didn't know you were supposed to take care of your spine and nervous system from birth. And because of that, your body's degenerated and health's degenerated to a point where now you have a problem. In fact, you have 19 problems.
Yeah.
So what we're going to do is start the healing. We're not looking to reduce the symptom. Exactly. Because how many people, and so the only problem you're fixing is a lifestyle problem. You're not a doctor solving a health problem, and that's what you communicated to them, which is why they're complaining. And if you look at the medical model, an MD only sees them, maybe once a month or whatever. And if you only saw them once a month, what would you do? You'd have a consultation. So they think 3 times a week The purpose of that is for them to come in and tell you what the problems are because you taught them that, even if it wasn't your intention.
Correct.
So I'm going to tell one story real quick. I learned to evaluate subjective complaints after a while. We would go over improvements because we did a consultation that got all these organ and health problems, right? And so every 30 days, we would look at the improvement. I mean, obviously their pain was one thing, but we didn't even really focus on the pain. We focused on the organ problems. So I didn't do this until I was about 10 or 11 years into practice. But I trained them on healing right from day one. So patients would come in, and I'd be like, God, you've been with me a year or something. I don't know, whatever. And you still have 20% of your back pain? I go, you have back pain? Because we never talked about it. And they would go, yeah, don't worry about it. I'm like, I didn't know your back hurt because we never talked about it. They go, Dr. Fred, it's okay. It's getting better. Don't worry about my asthma's better, man. I have so much more energy. Doc, you gave me a new life. I'm so grateful for my family. I'm like, I didn't know your back hurt. And they're like, Dr. Fred, don't worry about it. It's okay. It's getting better. But look, I have a new life, because that was the focus from day one. I didn't even know they had neck pain. They
Right.
didn't even care.
Right.
They
Right.
don't care. Now, obviously, it's not an 8 out of 10. Maybe it was a 2 or 3 or,
Sure.
1, but they don't even care because they have a bigger helicopter view.
Yes.
They're not walking through the forest trying to pick the ants off the bark of one tree. They're in a helicopter because they see livestock.
Yes.
And we did that from day one.
Yes.
And
You know,
that's really
I
because it was about healing.
I I hear where we're talking about machines and such. So listen, I'm not here to point fingers, or I'm not here to disenfranchise the mindset of a chiropractor. I will tell you this though, that the idea that if your office is busy, and I mean busy, I don't have time to do a machine.
No,
I don't have time to stand there and rub something on somebody.
no.
I don't have time to put them in something. So let's really, in most cases, almost all cases. Now, some of the new people coming out of school, they're taught all this stuff, so you get confused, and I can appreciate that. They're teaching you an allopathic, natural allopathy. A lot of times the profession was pitted up against medicine. You hear people talk about, we're better than this, we're better than surgery, we're better than drugs, we're better than this. My answer has always been like, just like Mother Teresa, like, I don't want to be against something. I want to be for something, So the attitude that I always have is, who cares? Like, I'm not going to poke the bear. We get frustrated, medical doctors, oh, they don't refer, they say these bad things, because we've been saying the most horrible, horrific things about them for the last 100 years. So, the idea that, they don't have any value, that there's nothing good that they do, that's ridiculous. Of course, they do great things. And of course, there's a necessity for that, right? But BJ taught us to stay in our own lane. Like, if my lane is subluxation, like, again, I'm not saying soft wave doesn't do good things, but that doesn't identify, analyze, or correct subluxation, right? Ultrasound and all these other modalities that docs are using in their practice. Red light therapy, phenomenal. I'm not saying it doesn't help people. I'm not saying nutrition doesn't help people. I'm not saying that. But what I'm saying is, what would be your reaction if you went to a dentist, or even better, an orthodontist, and he starts talking about your knee? Or would you even ask your orthodontist about your knee or your foot or an ankle problem? Like, you never would do that, ever. So the idea is they stay in their lane and they get it, and they're highly, highly successful. So if we stay in our lane and we talk about subluxation, we talk about spinal health and nervous system health and innate and energy and the expression of intelligence, and when the spine gets crooked, it's affecting that, then what we're going to do is we're going to see mom, dad, and kids. We're going to see them when they feel good, even though they need care desperately because they're subluxated. We're going to see a bunch of non-symptomatic people in an effort to keep them healthy, because what did Dee Dee teach us, right? I'm going to use these two hands to take care of the sick, but to keep the healthy from getting sick. So if I'm focused from that perspective, why would I want to use all those other things? Like they're not congruent with chiropractic. Chiropractic is to be done with hands. It doesn't mean that those things don't have a place. It doesn't mean they don't help people, but it isn't in line with what chiropractic is. Chiropractic is the identification and correction of subluxation, which interferes with the expression of the nervous system, with innate. So the reality is that's really what it is we do. Anything else is a confusion. So the minute I start bringing other things in, I'm literally immediately starting to cause confusion, natural allopathy, a treatment mindset. And then what I'm doing is I'm going to bed worrying about how many new ones I got this week to make sure I can pay my bills or keep my numbers where they are, rather than going to bed and being excited because I got a bunch of people coming in and I love my practice and I'm not living under a stress life. And that, I mean, that's honest. That is the reality. And some guys don't want to hear it. And some guys get pissed, and I appreciate it. And I'm not trying to piss people off. But what would you rather have? Would you rather go to your office and have 100, 200, 300 people lined up to go see in a single day, where people could come in and they're in and out and you're getting high fives and hugs, and we're not listening to 90% of people go, okay, before you touch me, let me tell you everything that's wrong with me? Or, right? Or do I want to go to a practice where I'm like, okay, sit down. What's going on? Tell me when it bothered you. When does it hurt? What's going on? Let me use this machine. Let me do this. Oh, and by the way, maybe I'll manipulate you while you're here. What the hell? And I'll give you some other supplements, and I'll give you a bunch of nutrition. And I get all that. Again, I'm not saying it doesn't help people, but it isn't what we do as chiropractors. It's not what chiropractic is. It never was intended to do that. So,
Well, exactly. 25 years ago, I tore my ACL skiing. So what I do? I went to an MD and I got an ACL replacement, right? My patellar tendon. It was strong for 25 years, and I just twisted the crap out of my knee about a month ago, and I know I have a partial tear in my meniscus and ACL. But what am I doing? I'm so glad I have a laser. I have a class 4 hot laser because I got a ligament injury, but that's not chiropractic.
right.
Right. I know the difference. So, hey, does soft wave help? Absolutely. People get joint injuries. Sure, it's going to help, but that's not chiropractic. So do they know the difference? And then, like what you say, I see people and I talk to people that use electric muscle stim. Well, why do they do that? Because they tell them we're trying to reduce the pain. Well, right there, you may have gone through day one, day two, got all the organ
Right.
problems, and now you're communicating, you just went backwards. And then what else do people do? They put them under intensive care. Maybe they come every day. And then when do you get your frequency reduced, maybe to corrective care? When the pain's gone. So here, maybe you have an intention on day one, day two. Well, I'm teaching about organs, but then when you apply whatever modalities you're using, you just erased everything you taught
Exactly.
them because the
Exactly.
repetition in intensive
Exactly.
care is going to override. They're already wired the same way, and you're taking them right back. Now, I'm not dogging on electric muscle stim or anything like that,
Yes.
but look at the reason they're having that conversation is because you taught them. And then another thing, when people go, dog, can you check my knee? Can you check my ankle? Can you check this? You know, and I have a doctor, we're transitioning away from that. And because you think you're in the customer service business.
Yes.
Well, I
Yes.
just want to keep them happy as
Yeah.
opposed to empowering them to live a
Yes.
different life.
Yes.
You are more of a
Yes.
self-empowerment coach
Yes.
than you are customer service. You want customer service? Go to Nordstrom.
Right.
Now,
Exactly.
customer service is automatic, but you think you're supposed to serve them rather than give them a narrow focus on how to live an amazing life.
Yes.
Now, if someone has a direct trauma, like I sprained my knee, I was running stairs after every first thing I do, get my knee adjusted. Why? It's a hinge joint. My tibia was rotated. It's still, realign it first and then heal the ligaments. So, but I mean, you got left thoracic translation. The whole weight of your upper body is coming down on your left side. Of course, you're going to have left hip pain. You're going to have left knee pain.
Yes.
So, yeah, so fix your freaking spine. I'm not going to sit there and adjust your knee.
Yes.
That's second. Plus,
Yes.
every time you chase those extremity problems, you're teaching them symptom care.
Yes.
Do I think you should have now all the extremity people, I do this and I do that? For what reason? Why do they have that problem? 80% of extremity problems are because their pelvis and spine is out of alignment. They have upper cervical problems, their
Absolutely.
whole weight distribution. The nerve energy is being cut down, shut down to their right shoulder. That's why they have shoulder problems. And then they lift weights, they're going to have elbow problems, wrist problems.
Yes. You know what? One of the things, because I get this from people, like, well, what do you do? Like, do people need some nutritional counseling? Yeah. Do people need
But I
therapy?
don't do it.
Yes. Do people need red light? Will they benefit from shortwave wave therapy? Will they benefit from electrical stim and such? Yes, of course. I'm not saying that. But you know what I do? I make sure that I have phenomenal relationships with people I take care of in my practice. And I did that deliberately so that
Yeah.
I can refer them to those people who are pro chiropractic, who I know are going to support everything I do and say because they live the lifestyle that I teach. And guess what? Now I got a great relationship. I got 2 physical therapists in the area. Guess what? You need therapy. I'm going to send you to a phenomenal physical therapist. In fact, I take care of them in my office, totally on point. I got medical doctors that I take care of. Listen, they're going to come in. You know what? I want you to get that evaluated by a medical doctor. And you know what? I got somebody. In fact, I take care of Dr. Sarah. She's phenomenal. She'll take care of you. So she's in line. She's not going to say anything negative, right? I've got people that are nutritionalists. I've got naturopathic doctors I take care of. So, hey, do you need nutritional attention? Yeah.
Not only
Let me
that, they're
refer you.
referring to you.
Right. So all of a sudden, guess what? It benefits me. How much money am I making? And how much time am I freaking wasting to stand there and tell somebody how many fucking milligrams of vitamin C or magnesium or vitamin D and blah, blah, blah. I'm standing at the table pontificating, blah, 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 blah. It's like, oh my God, I got 30 other people to adjust. I don't have time to go through all that right now. And by the way, you can go on Google and fucking look it up. I don't have to tell you. So go on Google and look it up. I'm here to adjust you. Google can't do it. AI can't do it. You can't pill it straight. You can't stretch it straight. You can't drug it straight. You can adjust it straight with a chiropractor. It's the only person that's going to do it. So if we get back to what we're doing, only good is going to happen. You're going to see more
Well,
people. You're going to serve more people. You're going to make more money. You're going to have more freedom. You're going to work 3 days a week, Monday, Wednesday, Thursday. You're going to kill it. You're going to have 3-day weekends. You're going to be able to take a few weeks off a year and enjoy it with your family. You're going to love what you do. I mean, that is the $1 million, the perfect practice. Why do we screw that up?
well, and I'll tell you, and here's what you didn't say, but you're saying without saying this mantra, be the best in the world at one thing,
Yes. Yes.
chiropractic.
Yes.
So I remember we had a nutritionist in our office. His name was Steve. Doug Frey, what do you think about? Now, the problem is you think because you're a healthcare provider, you have to have all this knowledge and I have to guide you. No, 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 no. You decide when my practice went through the roof, started going through the roof, when I decided to be the best at one thing,
Yes.
right? Opening up energy in the body,
Yes.
correcting the spine, right? And
Yes.
so when people say, well, what do you think about? Talk to Steve. Well, talk to Steve. Uh, 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 talk to Steve. His name is Steve, obviously. They'd be like, Steve. That was the end of the conversation.
Yeah, exactly.
If you're not giving me a hug and and you realize you're healed, there's nothing else to talk about.
Exactly.
Nope, Steve.
Yeah. Yeah.
I was just going to ask you if I could come in extra. Oh, sorry.
We have a sheet and it has the referrals. So we have referrals of everyone referred to in our practice. So if you're looking for anyone of any type, or I feel as though you would be better served to go see somebody in addition to what we do in the office, right? It's not in replacement of what I do
No.
because, right? So if you need nutrition, if you need exercise, if you need physical therapy, if you need a trainer, if you need a medical doctor in a certain specialty, whatever that I think you'd be served well, here's the list. And I could tell you 100%. Everyone on the list I know personally, everyone on that list has been adjusted at least once in my office. They know who I am. They know what it's about. They know what chiropractic's about. They know what I'm about. They're in congruency. They're never going to say anything negative. We have a great relationship going back and forth. We had a doc that I would refer people to years ago. His name was Zogby. He unfortunately passed away. A really, really nice guy. And he was a spine guy, and he kept talking about chiropractic. And, he wasn't really for it or against it. He didn't know anything about it. I said, well, why don't you come in? He's like, it's funny you say that. Like, I work with chiropractors. No one's ever said to come into my office, ever.
Oh my
Think about
God.
that shit. So here we are as chiropractors, and no one said to the ortho, hey, come on in. So, geez, Dr. Zogby comes into my office, and he was under care for maybe about a month and a half or 2 months. He ended up seeing somebody else because out of convenience, closer, he was a distance away. And geez, he was like, it just changed his whole perspective on what we do. He had another ortho in his office, and I can't say his name because of HIP and all that. But so Dr. Dan ends up coming in because he had some problems, and he's an ortho, really medical, very concerned, critical of chiropractic. But because of Dr. Zogby, he said, all right, what the hell? I'll go see him. Geez, I started taking care of Dr. Dan, and he does knees and shoulders. So he did a scope on my knee and shoulder a number of years later. I saw his wife. I saw his 2 daughters. His
Of
one daughter
course.
was deciding like, hey, should I go to chiropractor school or medical school? So he's like, what did you do to my daughters? I thought they were both going to be medical doctors. Now what is she ended up going to medical, but probably because of his insistence. But she loved the office, loved getting adjusted. She was thinking about going to chiropractic school because I said to the doctor on the phone, why don't you come in and let me check it? Let's have a conversation. Oh my God, no one's ever said that before. Like, what are we doing? What are
Well,
we
let's go beyond that, man. I wouldn't refer to any other healthcare provider, attorney. I wouldn't refer to anyone that wasn't a patient
Yeah,
because how are they going to get it? And
right.
then, of course, once they get it, then yeah, you do have their wife, you do have their kids. That's like, people with PI cases. Well, we do correction, we teach lifestyle, but they're a PI case. Ah, are they a person?
Right.
Did a
Exactly.
person, child of God, just get in an accident? Like,
Exactly.
if your PI cases aren't referring their wife and kids or their husband and kids, they don't get it. That's why they quit and leave. Like, if you
Yeah.
have a PI case and they really get it, I mean, Joe, I know you've had this, and probably people listening, where people were going through a day to ROF on a PI case and they go, you know what? I'm glad I got in this accident because I never would have known this.
Right.
You know how many times we got that? And then what's the probability? How many PI cases start and then quit when the PI case is done?
Exactly.
Right. But if their wife and kids are coming in, what's the probability they're going to stay?
Exactly.
It's like they're only, that's why, well, they're a PI case. Well, are they a person? Do they have a spinal cord and nervous system?
Exactly.
Yeah.
Exactly.
And now that they're injured, they're going to get sicker faster. They need it more. And
Correct.
they probably have ligament injuries, which means their spine may have some permanent instability.
Exactly.
Like, they need to be lifetime more. Same thing with scoliosis. Well, we braced them or we did this. No, no, they get worse if you don't. Like,
Exactly.
you got to get them under 30 degrees, man,
Exactly.
or whatever. They need to be under
Yes.
chiropractic care for the rest of their life. And it's a generational pattern. First question.
Exactly.
You get a
Exactly.
13-year-old girl with scoliosis, you got it from your mom or your aunt.
Right.
7 to 1 women. This is a
Yes.
generational pattern. Let's
Yes.
look at your sisters. Let's look at your brothers. Let's look at your mom. You got it. Let's look at your aunts, your
Yes.
uncles.
Yes.
And then when you have kids, we're getting them from birth because that will never form.
Yes. Yes. And it
As
comes down to
opposed
what
to,
I go ahead. Go ahead.
I'm just fixing the scoliosis on this one person.
Well, comes down to what our premise of today is, right? Do you care or treat? Like when I
Yeah,
look at
absolutely.
somebody, they all need to be cared for. Like when a dentist looks at you, they're not like, hey, do you have a cavity? The dentist is like, hey, are you fucking brushing and flossing? Like
Yeah.
they're looking at you from the standpoint of, are you taking care of your teeth? Not if you have a dental so-called problem. Obviously, you have a dental problem every day if you're not brushing, but are you taking care of your teeth? That's their initial premise. So we need to start the same way. Hey, are you taking care of your spine and your nervous system? Like, are
And if
you
you're an
taking
Italian
care of
dentist on the East Coast, they are saying, are you fucking brushing and flossing?
exactly.
You're like, hey,
So
you
when I
speak.
look
Yeah,
at
hey, come on.
a man, a female, a child, a senior citizen, like I'm looking at everyone like, are you taking care of yourself? Like, I want you to eat good. Absolutely. Hey, listen, here's a handout right here. Any further information you need? I got 3 referrals right on the bottom corner. Just call them because I'm not a nutritionist, refer, right? Here's some exercises, simple things to do. You need any further? Here's 3 physical therapists right here to call. They're absolutely phenomenal. Boom. There you go. I mean, that's how I handle it in my office, right? But the reality is, are you being cared for? Is someone taking care of you? And if I look at that funnel, everybody needs care. Everybody is a practice member, a potential practice member.
Well, and you are the gatekeeper.
Right.
You're the gatekeeper. They come to you first.
Yes. Yes. Yes.
I heard a great one-liner. God, I forget who I was talking to. They said, if they're not saying yes to chiropractic, then they're saying yes to medicine.
Yes.
Like they got to say yes to chiropractic primary first, or they're going to say yes to medicine. Now, you may have people you think, well, they'll come to me forever. They've been coming to me for 20 years. What happened with COVID when they said stay home? Did they stay home? What was the difference between the people, that got on the subway, that got on the train, that drove through and came to you when other people wouldn't? What was the difference between those people and the people that decided, yeah, I've been under for 15 years, but you know what? I got to stay home because CNN told me.
Yeah,
Who's their
exactly.
healthcare leader?
Yeah.
NBC?
Exactly.
CBS? That's their healthcare leader? They stopped doing what you told them because the TV.
You staying open is opening that door. You staying open in spite of what was going on makes people go, hey, well, Boreo's open, Fred's open. Like, okay, that immediately says leadership. It literally says health. Hey, listen, with all this craziness going on, you still need to be taken care of. You're still brushing your teeth. You're still eating good. You're still exercising the best you can under the constraints. You got to get the spine and nervous system. I got to tell you a real quick story. So I'm almost 60 years old. I know it's hard to believe because I look so young, but
Damn, you look good.
yeah. So I'm almost 60. So I've basically moved to Florida, and I have a new family doctor down here that I have to go because I have other insurances that, you got to meet all their criteria. So I go meet this guy, and this was on Monday. Monday at, it doesn't really matter, 3:00. I believe it was 3:00. So I went in to meet this guy. Now, what had happened was I thought it was really smart. About a week or two before I had the appointment, he said, hey, listen, come to the office and I want you to do an EKG and we're going to do a whole series of blood work on it. I'm like, okay. He goes, we'll do all that and then I'll check you when you come in. We're going to do an exam and physical. Okay. So I'm thinking exam and physical. What am I going to do? I'm going to do a prostate. He's going to palpate me. He's going to look all over my body. He's going to stethoscope me. He's going to do all kinds of stuff. That's what I'm thinking, right? I literally go in, really nice guy, younger doctor, nothing against him personally, but think about this, Fred. I walk into the room, lady takes my blood pressure. I'm 120 over 82. But my heart rate is 70 and my oxygenation rate was 98. Okay. All my blood work was normal except my total cholesterol, which was elevated to 212. However, because my HDL was higher than the standard, my total cholesterol was over 200. Okay. So that's my story. I go in, the minute I go in, they do the blood pressure, blah, blah, with the nurse. Doctor walks in and he says, okay, doc, he says, listen, I'm going through your health history from your other doc in New York. I wanted to talk to you about a couple of things. He said, you're behind on your vaccinations. First thing out of his mouth, he goes, you haven't had the pneumonia vaccine. You haven't had the flu vaccine. I see that you haven't had the COVID vaccine. And he goes, you haven't even had the shingles vaccine. This is the first thing out of this fucking guy's mouth. And I'm like, yeah, well, I'm not really open to that. Well, he said, COVID, obviously, I can understand that. That's kind of gotten down. He goes, but, I had a history of blood clots in my lungs, and that's another story. So he said, because of that, you're a higher risk. I really think we should do the pneumonia. And I go, well, my EKG is normal and my oxygenation is totally normal. Blood pressure is normal. I said, and, so I'm not really big on getting the pneumonia or any vaccine. He goes, well, the shingles, you ever seen people with shingles at your age or older, blah, blah, blah. I mean, the guy's giving me a strong arm on all the fucking vaccines. I'm just walked in. Everything's normal on my every test I've had. So I'm like, so I said, no, no, no. He goes, all right, I appreciate that. I appreciate that. He goes, well, one of the tests I'd like to do is a CT scan. He said, because your total cholesterol is elevated. He said, and as such, I really like to get you on some cholesterol lowering drugs. So I said, well, geez, can I see the blood work? I hadn't seen it yet. And I said, well, geez, my HDL is what's elevating. It's so if you look at my cardiac profile ratio, it's actually like 0. Like I have no risk at all, right? And he says, well, I understand that, but we really want to have it down to 180, maybe even lower. So even if I take into account your HDL being elevated, you're still not below the 180 mark, and that's 60 and blah, blah, blah. And I'm like, well, my familial history doesn't have any cardiovascular disease at all, Well, your history of clots, blah, blah, blah. I'm like, yeah, no, I'm not going to do any cholesterol drug, anything like that. He goes, all right, well, we'll check it in 6 months. We'll check it in 6 months, but I'll put you on a baby dosage. I'll put you on the lowest dosage. I said, okay. And then he says, in regards to your blood pressure, I know you're within that normal range. Normal range, I'm fucking dead perfect. Like, I'm perfect. And he says, well, because of that history of clots you've had, and being your age and such, we really like to get that blood pressure a little lower. So I'd like to put you on some blood pressure medication. Again, I'll put you on the lowest dosage possible. And I'm like, no. And I started laughing at this point. He goes, okay, I kind of see a trend here. He says, well, you're probably not going to like my last recommendation. I go, what's that? He goes, well, your BMI. And I said, yeah. So I'm 5'10" and weigh about 236 pounds. Definitely a little heavier around the midsection. Just so you know, I spent 5 months in Italy this summer, but to be fair. But he says, so I'd like to get that down a little bit. We really like to get you to about 210. And I said, well, I think the BMI is not really accurate. I think you really want to do a percentage of muscle mass on my body, because I tend to be a little bit more muscular, with my legs and arms and such. And as such, I don't think the weight and the height are really going to give a good accurate BMI. And he says, well, I'd like to prescribe Ozempic for you. We'll put you on the lowest dose possible, 0.25 or whatever. And I said, dude, I go, are you fucking serious? He's like, yeah. I go, I'm not taking any medication. I'm not doing anything. I'm totally fine. I got to walk a little bit more and no more cannolis. I go, other than that, I'm going to be okay. And I literally walked out of there. And again, it was a nice guy. And I was like, thank God. Honestly, Fred, I walked out. I came right back to Melody and my lady, and I said, thank God I'm a chiropractor, because the average person walking in without some knowledge, without some conviction, without a view of what health is, the average person would have walked out of there with 4 to 6 vaccinations and probably 4 prescriptions when their blood work, blood pressure, all their physical evals are normal. My EKG is normal. Think about that. Everything was normal. And at the end, Fred, the last point I'll make, Dr. G, he never touched me. He didn't take a stethoscope and put it on me. He didn't palpate an organ. He didn't palpate or check my carotids or vertebrals. He did nothing. The nurse did my temperature, my blood pressure, my O2, and my heart rate. That was it, along with the blood work. And based on the blood work, they were like, you're perfectly healthy. However, we'd like to give you 4 vaccinations, 4 prescription drugs. I mean, literally, that's what my experience was going to the doc.
I can't believe you were that nice. I would
Yeah,
have said, are you a
I'm
legal
always nice.
drug pusher? Are you
I'm always
actually a legal? Is this the way you treat your patients? So they have frequent sickness visits with you. Like, are you a legal drug pusher? I remember last time I went to the MD, man. Actually, I was doing it for, I wanted to get some testosterone because I had a shoulder injury. And so anyway, he's like, well, based on your age, we have to do a prostate exam. And I'm looking at his hand, his big fat fingers. And I'm like, dude, if I pull my pants down, you're going to see a sign that says exit only. Like, I am not getting that.
I'm not putting stuff up there. I'm just saying, I'm not.
Yeah, I'm just saying. And once again, I had blood tests, hey, there's nothing that shows. So I said, do you mean?
There was one time in college that I was drunk and we were just an experiment. That's all it was.
Yeah. But I think it was a pool cue. I'm not sure which way. But, I'm like, my PST is normal, but I'm like, you're saying your digital palpation, when I have normal blood tests, I have no symptoms, urinary tract is fine, flow is fine. no restrictions, that your digital palpation is going to tell you something that we haven't already figured out.
Right, right.
Well, we just have to do it. No, we don't. We really don't have to do
We
that.
don't.
No, I said, no, we don't. So, and then he's like, well, I can't continue having you as a patient if if I don't stick my finger up your ass. And I'm like, well, have a nice day.
Well,
And that
think
was the
about the
last time.
kid, think about the parents going to the pediatrician. And again, I'm
Oh
not,
my God.
I mean, think about your kid needs this and your kids need this. Like no pediatrician is saying, you know what, geez, let's check their spine and nervous system because, any blockage. I mean, Gutman did all kinds of research in the 70s showing impulses, blood flow, lymphatic pump, all of them, how significantly they're affected by vertebral blockages, as they would call them. He was a German researcher. And what would happen in the upper cervical. He's not going to say, listen, let's talk about how much sugar you giving your child. Are you putting seed oils? Are they deficient in nutrition? Are you giving them a simple multi? I mean, are
Are
you
they
giving them
going to a
living food?
chiropractor?
Right. Well, that's the first thing I said, so
Yeah.
so that's what I mean. They're not going to do any of that. They're just going to go, hey, listen, let's give them an antibiotic. Let's give them this pill to go to the bathroom. Let's give them this pill because their face looks a little red and they're a little stuffy. And then the next thing, and the mother, the father isn't going to have most of them, unfortunately, they don't have the knowledge, they don't have the experience, they don't have the conviction to say, Mom, or Doc, hold on a second. What can I do more naturally? What should I be doing? They haven't even, and listen, no offense, if they go to more than half the chiropractors in the United States, hell, the chiropractors aren't even going to adjust the kids. They're not even going to educate the mom and dad to why the child should be in there. When I go over a science article every week in my coaching program, every week we go over science to substantiate the need and requirement, the necessity of an adjustment. And the parents haven't even gotten the story of the ones that are going to the chiropractor, because the
I want to
chiropractor
be in your coaching
neck,
group.
back, and everything. Neck, back, and everything else. It's like, what are you doing? What are we doing? We're our own worst enemy, and then we complain that the practice is so difficult. It's like, dude, start practicing chiropractic. It won't be so
Yeah.
difficult.
Well, and today you got to teach vaccination workshops. I was on
Totally.
a coaching call the other day, which the doctor's so amazing, is growing through the roof, and he adjusted a 3-day-old baby. Thank God, took care of the mother through pregnancy, had the kid in the hospital, even though so it was a midwife. And then I'm like, all right, did you ask about vaccination? Like, how'd you get out of the hospital? You know what it's like to try and get a baby out of the hospital without getting vaccinated?
Yes.
That would be one of the first things. Great, let's suggest some. Okay, just curious. How'd you get out of the hospital? Did you vaccinate them? How'd you get out of there? It doesn't even matter with the midwife, man. The nurses are going to come in there, right? So, so it's like, well, you need to teach a vaccination workshop. And I've talked to people about that. Well, it's very controversial. I know. That's the point.
Right.
Like, that's
Exactly.
why you should. And then, I said, we get so happy with the fact that, hey, the parents get it. I'm adjusting them in 3 days. I'm like, did you talk to them about, if your purpose is to break generational patterns and to change healthcare, did you say, by the way, the fact that we're starting this kid in chiropractic now, this is going to be the healthcare for the rest of their life? Would you agree? And then do you realize that all the generational patterns that have come through you guys from this child forward, this child and every future generation, we just broke that pattern? Because
Yeah.
spinal patterns go through generations.
Yes.
I mean, how many moms or dads and kids, and you could overlay the x-rays, they look exactly the same.
Yes. Yeah.
Yeah, we just broke this generational pattern from your son to every future generation. Now, one will start with chiropractic, two will never get vaccinated.
Yes. Yes.
That's how you change healthcare.
There's a huge pushback right now. I don't know if you've seen, there was a lawsuit which was huge on fluoride. Now you've got two municipalities locally that are dropped fluoride because of this lawsuit.
Saw
And
that.
according to research, yeah. And now they're saying Kennedy, along with two other people, lawyers came out and said, based upon what just happened, they're probably going to eliminate fluoride in all water. Now, how long they've been talking about doing that, and that was a big conspiracy. Everybody, you're crazy, you're a freak, and so forth, and you're trying to discredit you. And then all of a sudden they find out, holy cow, it lowers IQ, causes calcification of different areas of the body, along with all kinds of other stuff. It has a very, very small percentage, and I don't even know if I believe the research on lowering dental problems, cavities, but simple dental hygiene will do that. And so it's out there, it's happening. You're seeing a lot of pushback. There was another reveal. I don't know if you saw that the large food companies gave a $20 million incentive to the American Heart Association to talk. And this just came out recently, the big reveal that they basically paid them off to tell them that hydrogenated oils and seed oils were healthier than saturated fats, saturated oils. So, I mean, you start looking at, the food pyramid, and you got some guys out there that are really starting to sing the word. But the problem is, here's the problem. And I posted this a while ago. For us as a profession, we get more excited about talking about that than we do about chiropractic.
Right.
And that's the problem that we run into. Are those things important? Should we talk about them periodically? Absolutely. Should we make posts and such about them? Yeah. But if you're going to spend an hour on Facebook and you're going to be posting the problems of Tylenol, the problems of this, the problems of that, I'm not saying not even put that out there, but at least put the equal amount, if not one more post about the benefits of chiropractic care. Why are we more excited? I see all these fucking chiropractors jumping in ice baths talking about how great they are. They are. I'm not saying they don't cause all these benefits, but we're more excited about that than we are about what we do as chiropractors. It's like, you want to know what the challenge is? Get excited, become, like you said, Fred, become the best chiropractor at what you do. Talk about it, study it, become an expert on subluxation, about innate, the metaphysical, the physical, the physiological, every aspect of chiropractic. And guess what? When you go in the office, everyone needs to be cared for. All of a sudden it becomes easy. Become concerned and become an expert.
Well, not only that, then you don't want to talk about anything else.
Right.
Doc, what do you think about ice baths? Well, I don't do them. I go swimming in the ocean, which is getting, for now, it's getting pretty close to an ice bath. But then it's like, well, yeah, I go swimming in the ocean. Now let's talk about healing.
Right. Exactly.
Yeah, it's like, then when you get that, you don't want to talk about anything else.
Exactly.
What else is important?
Right. I saw these chiropractors online, and again, I love them. They're not bad people, but they're, oh yeah, it causes an increase of dopamine. It increases your physiology. I don't know about brown fat stimulation, burns more calories, increases your internal thermometer, blah, 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 lowers inflammation. I'm like, holy shit. Look how fucking animated and excited he is about putting somebody in an ice bath, which again, I'm not saying doesn't do all those things. Can you imagine if you put a podcast and a statement once a week on your page, and we're that excited and talking about all the benefits of chiropractic care? We could basically talk about every aspect of your physiology.
We would change healthcare.
Right.
Instead of
talking about all this other shit, which is good, but we're not talking about what we do. It's like a dentist complaining that he can't get any new patients, and he's talking about orthopedic orthotics for your fucking feet. And he's like, I don't know why no one's coming in for their teeth, because you're not talking about what the fuck it is you do in your practice. Jesus, come on, guys.
Is that the way you talk to your clients?
Probably.
I know, me too.
I mean, I love the profession. I love the docs, and I'm not here to yell, and I know I get animated, and I'm an Italian. I know Melody always says, "What are you yelling at me?" I go, "I'm not yelling at you. I'm yelling because I'm irritated or passionate about something. I'm not yelling at you."
You're not even yelling. You'll know if I'm yelling. Trust me.
Yeah.
The windows will start rattling.
You as a person, you as a chiropractor out there listening to us, you are 10 times more powerful. The hard, heavy lifting was done by Didi and BJ and all the great chiropractors, men and women
paved the road
before them. They did. They paid the rent. It's right there for us. It's right there. Medicine, and everybody's starting to look at the nervous system and the physiology, the research, and everything is finally supporting and substantiating everything we do. We're right there. Don't blow it. We're right there to take over healthcare. It's unbelievable.
Yeah, Well, as usual, man, we didn't really kind of know what we had one sentence of what we're going to talk about,
Care
and then
versus
we,
treat, man. Care versus treat.
care
Start caring
versus
for people.
treat,
Stop
and then
treating them.
now it's been 58 minutes, so that's how this goes. So anyway, hey, we love you guys. You know, I would probably send this out. I would probably listen to it a few times while you're on the treadmill, while you're lifting weights, while you're
Absolutely.
going for a walk by the beach or whatever it is that you do, driving in your car. Take this into your heart. Become the best in the world for you at one thing, and you literally will double your practice. You'll literally only talk about one thing. You'll literally see more families than you've ever seen. And then you'll end up creating a legacy that affects generations rather than building a practice. If your goal is to build a practice, you get bored.
Exactly.
When you want to change healthcare, you have purpose for life.
Exactly. Boom.
Boom, done.
Boom.
There you go.
Bravissimo. Molto grazie.
Yeah. All right, brother. Hey, love you, man.
Ciao.
We'll see you guys in a couple of weeks. Peace.
Peace.